The Indian corporate hospital sector is undergoing a massive physical expansion. Millions of square feet of clinical space are being built across the country to accommodate increasingly complex medical needs. Three specific forces are driving this build-out: an aging domestic demographic, a surge in international medical tourism, and rising domestic health insurance penetration that allows more patients to afford private care. Global Health Limited, known publicly as Medanta, is aggressively capitalizing on this demand. By the end of fiscal year 2026, their top-line revenue jumped nearly 20% to 45,089 million rupees. This chart shows top-line revenue growth across the sector, overlaid with current price-to-earnings multiples. To buy into Medanta's growth, investors pay a steep premium, 55 to 64 times PE multiple. But look at the divergence. While Medanta's revenue climbs sharply, this secondary line tracks their operating profitability. Their EBITDA margin compressed down to 23.4% in FY26. This creates a pricing dilemma. Does Medanta's strategy of building massive regional clinical hubs justify buying at this premium, especially when you compare them to established pan-India giants like Apollo? Investing in Medanta requires accepting a specific trade-off. You have to tolerate short-term financial drag to secure what the company is actually building: long-term, high-acuity regional monopolies. Medanta operates a highly specific clinical footprint. Rather than trying to put a hospital in every state, they focus on dominating underserved, high-acuity corridors across North, Central, and East India. They execute this through an institution of institutes model. By grouping clinical departments like oncology, neurosciences, and cardiac surgery into specialized multidisciplinary campuses, they have the immediate infrastructure to handle complex, multi-organ transplant cases that smaller hospitals have to refer out. This chart plots average revenue per occupied bed against the industry benchmark. Managing quaternary procedures drives Medanta's average revenue per bed to 66,687 rupees a day. Adding the average length of stay reveals a highly efficient 3.02 days. Standardized, doctor-led pathways allow Medanta to discharge patients safely and quickly, freeing up beds for the next high-tariff surgical admission. The trade-off of this approach is geography. Prioritizing massive, high-acuity clinical hubs means Medanta misses out on capturing high-volume, low-acuity patients in smaller suburban micromarkets. The meta-city model creates an incredibly profitable clinical core. However, the sheer operational complexity required to run it prevents Medanta from easily replicating this model on every street corner. Medanta is currently executing a massive capacity expansion. In fiscal year 2026 alone, their total network bed count grew by 20.5%, reaching 3,579 beds. Much of this growth comes from greenfield projects, building massive facilities entirely from scratch. The newly commissioned 382-bed Noida hospital in the National Capital Region is their latest example. Greenfield expansions carry severe, immediate financial consequences. The company incurs massive initial construction and startup costs, followed by months of temporarily low bed occupancy, while clinical teams are onboarded and patient referral pathways are established. This waterfall chart breaks down Medanta's FY26 EBITDA. Startup losses from the new Noida facility pulled the consolidated margin down to 23.4%. But isolating the mature asset portfolio shows the core network operates at a healthier 25.7% margin. This margin compression is a temporary penalty paid to secure custom-built quaternary capacity for the next decade. To protect their future margins while marching toward a target of 6,000 beds, Medanta is shifting toward capital-efficient expansion models. They are increasingly utilizing an asset-light strategy. By forming a joint venture with the developer DLF to build a new 400-bed hospital in South Delhi, Medanta completely bypasses the heavy upfront capital expenditure normally required for premium land acquisition. They are also executing targeted brownfield acquisitions. Look at this architectural schematic. Medanta purchased a fully built 80-bed cancer hospital in Indore, located just 500 meters from their existing hub. Well, these strategic pivots have distinct advantages. Because the facilities are already built or the land is secured via partner, Medanta sidesteps regulatory land allocation risks and can begin generating cash flow almost immediately. Their final operational lever is the public-private partnership. The Patna facility operates entirely under a government concession agreement. Partnering with government welfare schemes guarantees a high baseline of patient volume. This steady influx of patients helps Medanta hold a stable 61 to 62% occupancy rate across the network, even as they rapidly add new beds. However, the trade-off here is financial realization. These high-volume government schemes pay significantly less than premium private insurance, which lowers the group's overall average revenue per bed. By balancing premium quaternary hubs with asset-light pivots and high-volume government partnerships, Medanta creates a highly predictable revenue floor to safely fund their massive expansion pipeline. Evaluating Medanta's premium valuation requires benchmarking it directly against its top 3 corporate competitors. This comparison matrix lines up the big 3 alongside Medanta. Looking at bed capacity, Apollo operates a massive footprint of over 10,000 beds, whereas Medanta restricts itself to a regional quaternary model. Looking at revenue and margin, Max Healthcare leads. Focusing on affluent metro markets gives Max a sector-leading average revenue over 70,000 rupees. Compare that to Fortis, operating with lower margins during its turnaround. Medanta sits in a unique strategic middle ground. They deliver higher clinical acuity than Apollo or Fortis, but they operate a much more capital-intensive and regionally constrained model than Max. This quadrant chart plots short-term margin drag against investment horizon. For peak margins, the metro margin maximizer is Max Healthcare. Investors wanting a defensive national footprint and massive pharmacy network should choose Apollo. Finally, the growth optimizer. Investors with a 3 to 5 year horizon, willing to wait for new clinical capacity to mature, are the ideal fit for Medanta. And importantly, Medanta holds a net cash surplus of 8,123 million rupees. This deeply underleveraged balance sheet ensures they can actually fund this massive expansion pipeline without taking on crushing debt. Medanta serves as a meticulously planned, premium-priced growth engine for investors who believe in the long-term dominance of regional quaternary hubs.